The coming of the North Star has given us to see to it that the death mortality rate has come down, because we are able to access many services, and North Star staff is so hospitable.
North Star Alliance bring primary healthcare services to mobile populations across Africa. We target truck drivers, sex workers, and the communities where we set up our blue boxes.
Unajua mara nyingi tukiondoka kama unaenda Kongo, ule unakaa kule hakuna uwezi kujua afya yako kama wewe afya yako ipo vipi. Ndio maana unakuja kucheki afya kwa mara nyingi. Ni muhimu kwa dereva kucheki afya.
I started sex working 2014. When my husband died, my in-laws took away everything from me. So I had no options. I couldn't take my kids to school. I couldn't watch my kids staying at home. So I opted for this profession. I came in Bedbridge for sex working. They've educated us when it comes to HIV and AIDS. They've encouraged us to come and get tested. You should know your status. They've told us that our health is our right as sex workers. We have a right to health. This clinic has helped us because when we come, we are being welcomed as we are, and we are getting help. We are accessing drugs, so we are happy about this clinic.
They are not shy to say their things out to us. And it's the way we approach them, our PR, and the way we're trained to say the people matter and it's the client first. Leave your problems at home, care for the client. That's the difference with the public sector, whereby you can just say, coming out, but with them we've got time for them.
We set up in outlying areas where there is no access to healthcare services, at least within the radius of 50 kilometers.
So for most of the clients and the population we are serving, it's not easy for them to access services. That's why we call them a hard-to-reach population. So there's need for us as an organization, as a clinic, to come to the hotspots to provide the activities, the health services, STI screening, HIV testing.
Malaba border point being the entry and exit point of this country, Uganda, has a lot of people coming in and going out. On average, trucks, I think, between 4,000 to something cross and enter the border. This gives room for people who interact with the community, drivers, and gives exposure to diseases, to families, to individuals, especially STIs. We talk about AIDS, syphilis, gonorrhea.
Au tunakutana nao, lakini mara nyingi kuna sehemu zingine tunajizuia, kuna kutokana na mtu mwenye jinsi alivyo. Kuna sehemu zingine mtu ndio hiyo anapenda naye afanye. Kuna sehemu zingine unazidi, ila mara nyingi kama umekaa sana, mimi binadamu mwanaume niko safi, naweza kukutana nayo hali hiyo. Ni mara moja sana kwa natumia kondomu, kwa sio mara nyingi, lakini baada ya kupata somo tulikokutana pale ndio nishawishi, nikikutana na mtu ambaye sio mke wangu natumia kondomu.
With stigma is very much, you cannot even go to church, participate in what other communities are doing, other people in the community are doing, because when they look at you, they see you as an enemy, especially when we want to interact with married women, we want to interact with the community. We are shunned out because of this profession, but we want to be better people. Some of us have taken our kids to school, to university, using this profession, but I cannot go out in the open and say that's my profession, because it's something that in our culture here in Zimbabwe, it's a taboo.
We organize sensitization meetings with the local community and the sex workers so that the community can be able to understand the workings of the sex workers in the area, and there's a mutual understanding between the community and the sex workers. Something which has really touched my life is because by working with the peer educators who are sex workers, because we recruit them from the hotspots, the sex workers get really empowered, their self-esteem rises, they can talk in front of the local community, they can talk in front of police officers. They also explain what they do about HIV prevention, condom distribution, and also giving health talks to their fellow sex workers about living well.
You cannot go out there when you're not a member there. You have to be a peer at the same time. You have to be a sex worker, because it's too hard to talk to someone or to a group of people when you don't share same behaviors. So there it's very easy if you're a peer and you have something you share in common like sex work. It's very easy to talk to them.
People matter. We're doing these services for the people, by the people. So they need to know that they matter, how we carry ourselves around them, how we speak to them, how we dress when we're going to meet them. All those things, they really contribute to the fact that the people matter. Also, I do believe there's a quote that I came across one of the times in the past that says, when a group of people come together, they can do the work of superheroes. So with those people, they make North Star do really the work of superheroes.